It's Racquel on Revolution 935, and I have Dr. Matthew Korn on the phone. He is a primary care physician. He has 2 urgent care centers that are called FastCare in Aventura and Miami Beach. Dr. Korn, thank you so much for giving me a call. I know you're probably very busy right now.
Oh, my pleasure. We are busy, but I'm always happy to talk.
Okay, so obviously coronavirus spreading very rapidly. What are different symptoms? Because it's also allergy season. One of my good friends has strep throat. She teaches children. So I think the best thing to do right now is kind of take a step back. What is the difference between different sicknesses right now?
Sure. Well, that's actually a great question because a lot of people are very concerned and some people are confused. You know, coronavirus, the typical symptoms are fever, cough, and shortness of breath. Also, the cough in coronavirus is more of a dry cough, not a very productive cough. When I say productive, that means a cough that produces a lot of phlegm and mucus that comes up. And you did hit a couple things on the head. There are other things out there specifically, like allergies, the common cold, the flu, and they are a little bit different. When it comes to the first one you asked me is allergies. Allergies is a little bit different than the symptoms of coronavirus. Allergies, you can get more of some upper respiratory symptoms. You can get sneezing. You can get itchy eyes. Specifically with allergies, it's more of kind of a chronic condition. You can even get some wheezing and things of that nature.
Okay, I know because I personally have very bad allergies and I've been waking up every morning with the itchy eyes, with the runny nose, and everyone's like, Corona. I'm like, no guys, I have allergies. I need to take care. I need to use my inhaler and all of that. But are you seeing an influx of patients coming in thinking that they have it, or is that kind of not happening to you yet?
Well, we definitely have patients, that are coming in and they are concerned. We do have a lot of people that are kind of worried. And, what we try to do is really educate them. We do a good exam on them and we really kind of differentiate of what they have. And, most people don't forget this is still March. This is still flu season. There are other things out there, colds, flu. So a lot of these symptoms, could be signs of other things.
Now, the first, thing that came out when hearing about coronavirus was social distancing. And I saw a lot of people out this weekend on social media in large groups, and probably not the smartest thing to do. So what at this point do you think people should do to stay proactive? Obviously social distancing, but let's say, I have to be at work. So what is the smartest thing to do right now?
Right, and that's also very good too. Obviously the social distancing is great, but people that can't, they have to be very smart about things. The biggest thing for me is pretty much hand washing and doing hand washing the proper way. Wash with a good soap and water, wash for at least 20 seconds. You'd be surprised how many people I see that wash their hands improperly. They just kind of run under soap and water for a few seconds, and that's not really good. You really need to use a good soap and water and use it at least 20 seconds. If you don't have access to soap and water, use a good hand sanitizer, something that has at least like a 60% alcohol base, and just be smart. Try not to touch your eyes, your nose. Just really be safe.
Now, could you be a carrier of coronavirus and have no symptoms?
So there is still a lot of research and debate on this going around, and they're constantly learning new things. It does take, for symptoms, to develop, it can take, they say, anywhere between, 2 to 14 days. What we do know right now is most of this stuff is through respiratory droplets. So coughing, so sneezing. That's why the 6 feet of distance is very important. If somebody coughs or sneezes and you're within 6 feet, if that goes into the mouth, into the eyes, that's how someone can get it.
Alrighty, thank you so much, Dr. Korn, for calling in. I know you're very, very busy right now. I appreciate you calling, and so does all of our listeners and everyone at Revolution 935.
Thank you. My pleasure.